It's my pleasure to be with you on another edition of Health News. Thank you for being with us on the program where we'll be looking into one of the vaccine-preventable illnesses known as measles. According to UNICEF, although measles deaths worldwide fell by 74% between 2000 and 2007, it's still disheartening to know that 500 children are lost to measles per day when there is a safe, effective and inexpensive vaccine to prevent the disease. So my question is, have you immunized your child or ward? Some people may have to think longer than others, but while you're at it, let's bring you details of some of the events that happened in the health world in the past week.
If the patient has cardiovascular risk,
call it back to school, and you may not be wrong. Doctors from different health institutions in Lagos State, southwest Nigeria, in a continuing professional development class.
now we all know there are major risk factors.
This lecture and workshop is designed to focus attention on the overall management of cardiorespiratory symptoms and primary and secondary prevention of cardiovascular disease in general. The Medical and Dental Council of Nigeria expects all doctors and dentists to undergo professional development and acquire at least 20 points per year that would form part of the requirement for the renewal of their practicing license.
Well, continuing medical education actually is the bedrock, the foundation of everything that we do. As doctors, we are teachers, we are educators, but we also must maintain a commitment to lifelong learning. So really, the 5 or 6 years that you do in medical school, you come out really, it's an admission that you know nothing. And when you consider also the fact that we are entrusted with the lives of individuals, the management of chronic disease, acute illnesses, it's a huge responsibility to shoulder.
One of the maybe the few people who actually have been yearning for this to happen in Nigeria. Many people came to Nigeria as purportedly doctors, start practicing. And those of us who also qualified here didn't actually have avenues to develop ourselves. We had to go out of the country. And even if we went to some of the conferences before, they were not of the same quality that we needed for our own self-development.
It's something that is very good for us, especially in this part of the world, because it keeps you on your toes, so to say. You get to know the current trends in medical practice, and it's also very good for our practice. You know, what you learn, you transfer to your patient. It helps you to manage them better as time goes on. So I think it's very good for us.
The need to monitor and report adverse drug reactions has been the major focus of a 2-day workshop for marketing authorization holders in the country held in Lagos. The event was organized by the National Agency for Food and Drug Administration and Control, NAFDAC, in collaboration with the World Health Organization Collaborating Center for Advocacy and Training in Pharmacovigilance. The Director General of the agency, Dr. Paul Ohi, stated that pharmaceutical companies hardly report patients' adverse reactions to drugs after usage. At the end of the training, it was expected that every company would acquire adequate marketing surveillance skills required to monitor their products in the market and promptly report adverse drug reactions.
Pharmacovigilance has become a global mainstay in clinical practice, and Nigeria must very quickly build up capacity across board in order to maintain the clinical attitude and practice of medicine safety monitoring. This fact is even more urgent in presence of counterfeit and substandard pharmaceutical products in our market.
If there's a report, we do investigation to ascertain the genuineness of that report. It is based on that inspection and investigation that we're able to confirm that there is a real reason for reporting.
One of the central events of 2012 in global health and HIV, the 19th International AIDS Conference, has opened in Washington, D.C., the United States of America. The conference theme, Turning the Tide Together, emphasizes the decisive actions needed in today's defining phase in the HIV epidemic. Some 25,000 scientists, people living with HIV, and other stakeholders are attending the conference that will also look at treatment for protection and, more broadly, the strategic use of ARVs. High-level speakers include U.S. Secretary of State Hillary Clinton, World Health Organization Director General Dr. Margaret Chan, and UNAIDS Executive Director Michelle Sidibe. Meanwhile, medical experts writing in The Lancet say drug-resistant HIV has been increasing in parts of sub-Saharan Africa over the last decade. Studies on 26,000 untreated HIV-positive people in developing countries were reviewed by the team. The researchers from the World Health Organization and University College London found the most rapid increase in drug resistance occurred in East Africa at 29% per year. In Southern Africa, it was 14% per year. They said resistance could build up if people failed to stick to drug regimes and because monitoring could be poor. There was no change in resistance over time in Latin America and in West and Central Africa. Further research into the causes of this drug resistance in Africa and urgent action to support people's daily access to their medication are needed. And finally, on health news headlines, the World Cancer Research Fund has identified a cutback on salty foods such as bacon and bread as one way of reducing the risk of developing stomach cancer. Too much salt is bad for blood pressure and can lead to heart disease and stroke, but it can also cause cancer. The recommended daily limit is 6 grams, about a level teaspoonful, but the World Cancer Research Fund said people were eating 8.6 grams a day. Eating too much salt is not all about sprinkling it over fish and chips. The vast majority is already inside food. This places even greater emphasis on making lifestyle choices to prevent the disease occurring in the first place, such as cutting down on salt intake and eating more fruit and vegetables. The World Cancer Research Fund is putting these findings under review alongside other emerging research in the field.
Art is a story. On Art House, we start from the beginning. The mixture of colors and the brushstrokes. The chiseled wonders that link art and science. The steps in each performance. The highs and the lows of emotion. The world of words, rhymes and rhythms.
But this is not a political poem. It's a revolution. It's the evolution of a people refusing to suffer and smile no more.
On every page, all the elements of a good read. Where else can you get it? Art House. Life is art.
Measles infection can be very uncomfortable, not with the fever and a rash. My guest on Health News, a general medical practitioner and medical director of Isolo Estate Clinic, Dr. Olatunde Olusumade, in this interview cautioned that although there are no specific treatment for measles, the symptoms must be properly treated to avoid complications.
Measles is a disease frequently occurring in infancy, in epidemics characterized by the reddish maculopapular rash and fever and caused by the measles virus.
Okay, so it's a viral infection.
Yes.
Is measles just in children?
Measles is mainly in infancy. It is recognized as one of the 6 childhood killer diseases in this part of the world. But occasionally, in people who have not had exposure to measles, it can actually occur in very few cases in people whose age is a bit advanced.
Okay. And what would be the incubation period?
Well, incubation period is actually the time from which you contact the infection to the time of onset of disease. In measles, it's between 10 to 14 days. Another thing that is important is what is called the prodromal period. And that is the time from which the sickness starts to the time in which the pathognomonic features of measles is recognized in somebody. And I'm talking about the rash. That is about 3 to 4 days.
Okay, and talking about some of the signs, is it just about the rash?
Well, just like the onset of the disease called measles is very difficult to differentiate from all other causes of fever and malaria in children, malaria and the rest. But by the time, after about 3 or 4 days of the onset of the general set of symptoms, you now begin to see the redness of the conjunctival and mucous membranes and the pathognomonic, what in our parlance we called maculopapular rash, starting from the extremities, starting from the proximal parts of the body, the head and neck, and gradually extending to the rest of the body. That is when the layman will recognize that this is measles.
Okay, so it must start from the head?
That is, yes, the distribution of the rash.
And the rash must also be red, right?
It must be red, yes.
Okay, so
that's why they call measles. It also can be referred to as a viral hemorrhagic fever. The redness of those rashes are small bleeding in the skin.
Okay. So when you say it's hemorrhagic, what does that mean?
Well, by using the term viral hemorrhagic fever, I'm referring to a general term of diseases that are caused by viruses, and they tend to increase the tendency of the sufferer to bleed. That is where you talk about measles, Lassa fever, Ebola fever, and the rest, viral hemorrhagic fever.
Okay. And now let's go back to the issue of transmission. Since it's a viral infection, what are the transmission mode?
Measles is usually transmitted as a droplet infection. Either the sufferer coughs or sneezes, and the droplets that are released into the atmosphere being inhaled by other people. That is what causes the spread of measles.
Okay, so it's not about touching?
No, it's droplet infection through the respiratory tract.
Okay. In an environment where a child's got measles and the others are also there, you find out that it's not everybody that will come down with the measles. Why would the other child, come down with the measles and not everyone?
Why some people have measles and some people don't have it in the same area? A lot of factors are responsible for it. Some children are actually immunized against measles and they will never have measles again, because immunity against measles confers a lifelong protection. Another cause is somebody who has had a previous experience with measles is like somebody who has been immunized against measles. If he comes in contact with another person with measles, he will not contract the disease again. These are some of the other factors. The other thing is the issue of the nutritional status. Some children that are actually well fed and well taken care of, people like that will have been immunized against measles, and in an area where you have a measles epidemic, they will be free from disease.
Okay, so malnutrition also, reduces the immunity of the child.
Yes.
And can predispose such a child to measles.
Yes, and another thing that also comes to mind is the issue of the HIV/AIDS epidemic. A child that is born and who has congenitally acquired HIV from the mother through the process of birth has measles as one of the hurdles on the way, will be susceptible to developing measles at the slightest exposure.
Okay, and talking about immunization, I know you mentioned a child has been immunized will not have measles. Is that given or is that taken?
It is taken, all other things being equal. That is why when you are talking about measles, what is gold standard in the prevention of measles is immunization. A child that is properly immunized against measles has a lifelong protection.
And this immunization comes when?
And the immunization of measles in this environment is given around the 9th month. In other Western world is given around 10 to 14 months. But here it's given around the 9 months.
Why the disparity?
Well, I would like to point out, really, that the reasons why immunization against measles is not given earlier is that the mother, during the course of pregnancy, will have transferred so much antibodies against measles and a lot of other things, and after the baby is delivered, the breastfed baby, especially in the first week after delivery, collects a lot of antibodies, such that if you actually give a baby measles immunization in the early months of pregnancy, the baby will have so much antibodies that he will not be able to make his own antibodies against measles, and immunization will not be effective. It is when you are approaching 9 months, all the immunoglobulins that the baby has acquired from the mother, either in pregnancy and through breast milk, are beginning to get to very low levels. That is when, against measles, you can now immunize around that time.
Okay, so can a child have the measles before that 9 months?
The reason why they don't actually give children before 9 months is that it's actually protected by maternal antibodies. So we usually don't see episodes of measles before 9 months.
Okay. When a child, has come down with measles, what should the parents do?
If a child comes down with measles, he will initially develop general sickness that will be characterized by fever, malaria, upper respiratory tract congestion, catarrh, and the rest. It is advised that they should consult a doctor who will examine and treat according to the clinical presentation. After a few days, when you see the characteristic symptoms of measles, I'm talking about the development of rashes and some of the things that you see in the mouth of the children. We call them Koplik spots. When you examine the mouth, you see them right there. The treatment still consists of trying to reduce the temperature and making sure that the fluid intake of the baby is optimum. The other treatment
Why is that important?
There's something they call dehydration fever. A child who has fever must have enough water in his system, such that his system will be able to deal with that fever by bringing the body temperature down. If he's dehydrated, he's not able to eat, he's vomiting. Measles occasionally come with diarrhea and vomiting, which leads to dehydration, which must be identified and treated by the attending doctor depending on the severity. Because measles itself is a viral infection that will come and is self-limiting. After having fever for about 5 to 7 days, it will just go on its own. But what the doctor does is to try and allay.
So there's no particular treatment for measles itself? It's
there's
just
no
the
particular
symptoms
treatment
that will
for
be
measles. What the doctor does is to treat the symptom of measles and look for the complications of measles and treat as soon as possible. What I'm really quickly to talk about is measles and respiratory tract infection in children. Measles with bronchopneumonia should be quickly identified by an attending doctor and treat. There are a lot of other complications of measles. In this environment is measles with bronchopneumonia. It must be seen and treated. But the worst part is measles can actually invade the brain and cause encephalitis. The mortality rate is bad. It is preceded by a previous exposure to, let's say, HIV or a bad nutritional status. Measles can have meningitis. The commonest one is measles with an infection of the ear and the middle ear, such that people who have had measles have actually come down with permanent disabilities like hearing loss, blindness, some form of paralysis, and some of these permanent sequelae. It is because of this that it is good for a doctor to actually attend to all cases of measles for the purpose of anticipating and identifying complications and treating them as early and as much as possible.
Okay, so even though the measles itself is not treated because it's a viral infection.
It's a viral infection, yes.
All of the symptoms must be checked and treated and make sure that it doesn't go into complications.
Yes.
You have said it's transmitted through droplets, and that is something that can we prevent, coming in contact with such?
I keep saying that there is a prodromal period of 10 to 14 days before the onset of disease, and transmission can actually occur before the onset of disease. And the other aspect of it is, even when disease starts, I'm talking about the incubation period of 10 to 14 days through which transmission of disease can occur. Another prodromal period of 3 to 4 days, which you still don't know that the baby has measles and it can be transmitted. So the best way to prevent the transmission of measles is actually the immunization, which has been there for a very long time, which has been promoted by the society, government, private sector. That is the only way that both measles and the rest of the childhood diseases can be prevented.
Okay, and if a child has had measles, is it true that, that child has a lifelong immunity against it?
He has a lifelong immunity against the development of measles, yes.
All right, thank you so much for speaking with us.
It's a pleasure.
Our definition of news revolves around you.
It's all about events and issues that affect you.
There's simply no limit to issues and events. Issues that will help you make important decisions and take actions.
And actions that could transform your life and the things around you.
Looking at all sides, we keep the story simple so you can understand it and make informed decisions.
It's really all about you.
That's what we do.
On Channels Television.
Your home for the news.
Immunization is key to preventing a whole lot of childhood diseases, so make sure your child or ward is fully immunized. Just before we go, let's share with you some of the responses to last week's topic on sleep disorders. On our feedback segment, the first concern is expressed by Danjuma Adamu from Abuja, and he said, "I find myself sleeping excessively. What's the problem and the solution?" And the next one is coming from Ade Hudenput, where he's writing from. It reads, "I'm happy to hear that there's a medication for narcolepsy. My wife's case has gotten to a point of hallucination, so please prescribe the drugs." And the final one is from Isaac in Warri, Delta State, south of Nigeria. And he said, "I can't sleep without sleeping drug. I have this hotness from my head to my waist. It's almost affecting my speech. I'm addicted to the sleeping drug. Please help." My reply to all the feedback messages is that on Health News, we do not prescribe drugs or do on-air diagnosis of individual cases. What we do is to provide a platform for you and the healthcare provider, so each of you can contact the consultant psychiatrist of the Federal Neuropsychiatric Hospital, Lagos, through the phone number that's in your mailbox right about now. Thank you so much for sharing your time with us. Let's hear from you. The way to go is healthnews@channelstv.com, or send your thoughts to 081-864-38129. Text messages only. I'm Yomi Otaigbe.